Who said they're starting at 10?
Oh, I gave a 1 minute warning. I started now the recording and I opened the waiting room. Please wait another 20 seconds, then we can start.
Okay.
Well, we're ready.
Hi, people. Just checking in to see that you're all well and ready to run.
Okay. Good morning, everyone. My name is Josephine Nzerem. I'm so super excited to welcome you to Making More Health Convention 2021. Today, we are looking at Africa and the future of global animal health. And we have amazing people that are going to dive into this topic. So I'm going to hand over to Femi to start the introductions. Dr. Femi.
All right, so my name is Dr. Femi Kayode. I've been a veterinary doctor for 15 years now. And then I'm the founder and CEO of Parmalat. I'm happy to be here.
Thank you, Dr. Femi. Peter?
Yeah, sorry, I was on mute. So my name is Peter Awin, and I'm the co-founder and CEO of CowTribe Technology. Yes, I'm not a doctor, but I'm also working in the animal health sector.
Thanks, Peter. Madam Baju?
Yes, good morning. Good to be here, and thanks for having me. AIG Aishatu Abubakar Baju. I'm the president of the Veterinary Council of Nigeria.
Thank you, Madam. Dr. Moses.
Good morning, everyone. My name is Dr. Moses Arokoye. I'm the regional sales manager for Central Sub-Saharan Africa, primarily a vet pushing 19, 20 years experience on the field. Thank you.
Wow, that's amazing. So we have a broad spectrum of people here that are going to delve into this session. So I'm going to hand over to Dr. Femi to give us a background. Dr. Femi.
All right. Thank you so much, Ma. I will just quickly share my screen. All right, so I'm going to be sharing a background of where we are in Africa and why we are where we are and what we need to do. It's going to be a much more robust discussion, but I'm going to be offering useful insight. I know the global animal health story is slightly different from what we have in Africa, but I want to say this categorically that it's not disconnected, especially because of the concept of the one health medicine that we are all now talking about. Everything is interrelated. So I'm going to be offering a few useful insights around what the animal health industry looks like in Africa. Right, so we have a huge problem at hand in Africa. A case study of Nigeria, 10 million livestock farmers in Nigeria cannot readily access quality and on-time animal health products and services. I give us a very quick example. We lost a few months ago, we lost over $3 million worth of livestock in one of the states in Nigeria because there are no quick access to vaccines. There was an outbreak of contagious bovine pleuropneumonia. Farmers are staying in places where vaccines cannot easily get to. We also have impending food crisis because of our increase in population. It's been estimated that around 2050, the population of Nigeria will double. We're on the 200 million mark now. We're expecting that by 2050, we will be around 400 million. If nothing is done to the livestock sector, we are looking at an impending danger. We also have the issue of low productivity in Africa. The average cattle in Nigeria gives an average of 1 to 2 liters of milk, maximum 3 liters. Whereas in the global scene, the improved cattle that we have could give as much as 40 liters. So you could see the difference. We have 1 to 2 liters in Nigeria. We have global breeds that can give you up to 40 liters of water. And the same goes also for meat. So we have cattle averaging around 200 to 300 kg that we consume here. And we have global brands, global cattle breeds, giving us sometimes even up to 1,000 kg. Africa is plagued with low productivity of some of our livestock breeds that we have. We also have the impending danger of disease outbreaks here and there. I think this has cost us a lot of money in Africa. Coupled with this, we have very weak veterinary surveillance systems. So if a disease is coming, sometimes it takes us weeks, sometimes even months to get the view that there's an impending danger. There's really no very strong active surveillance in Africa, Nigeria as a case study. Then we increasingly have this threat of antimicrobial resistance. Our drugs aren't working that much again. Humans are falling sick, and we really can't provide a solution because antimicrobials have gotten quite a lot of resistance. To cap this challenge up in Africa, we have poor infrastructures. The roads to where these livestock are bad. There's a supply chain crisis currently. Farmers can't get easy access to what they need to keep their livestock up and running. So there has to be a way. One of the things I believe as a background is that these are challenges, but it can be solved. We have the likes of me in Nigeria. We have the likes of Peter in Ghana, doing our bit as social enterprise to see how we can come in and resolve these numerous challenges. And part of the things we're going to be talking about today offers useful insight into these unique challenges I've just presented and how we get it solved. So we must build today the foundation to steer the livestock on a sustainable development trajectory in the future. And it's not just my responsibility, it's a responsibility for all of us. So with this background, we'll be opening up to thoughts of what's happening in Ghana. I'll be coming up again, offering insight on what we are doing in Farmerland. And then we have the president of the council and Dr. Moses also that will be sharing with us what the unique insights of what they are doing are and how we can move forward. So thank you very much. And I wish us a very good discussion.
Dr. Femi, thank you so much, Dr. Femi. I'm so happy that after sharing these challenges, you were able to also share with us a solution. And I love the solution of steering a livestock development on sustainable development trajectory for the future. This is so amazing. I can't wait to listen to Peter to hear what is happening in Ghana. So Peter, over to you. Thank you.
Yeah, thank you very much. I think Dr. Femi has, given us a clear overview of the challenge that we face in Africa. I don't think I'll be able to add more than that. But I must say that in looking at Ghana specifically, we have peculiar challenges when it comes to animal health. And as far as Cow Tribe is concerned, we have been more focused on preventive animal health because we do believe it sits at the core of, making, farmers be able to protect whatever they have. Typically, you would find that smallholder farmers, as he said, are located in very, very remote places. And so preventive animal health is not that accessible compared to, therapeutic or curative animal health. And so we need to recognize the differences as we continue to discuss this. And maybe the solutions also will lie in understanding those differences. And so when we started Cow Tribe, our main goal was to understand what really prevents farmers from accessing preventive animal health care. And one of the key things is the fact, as Dr. Femi mentioned, it's about the poor roads. It's also about, other factors. But the core of the issues that we are facing is that Africans, the farmers who produce, livestock in Africa, are also smallholder farmers who earn very little, and their money also come in seasons, So they are not like the commercial farmers who can stagger their productions over a period and decide when they want to bring in birds, and then, decide when they would cash in and cash out. The smallholder farmers are actually, depending on, the little that, nature can provide them, because they're covering their animals. And that is actually also the biggest challenge in getting funding that would be able to finance animal health, services. And so as we look at the distance and as we look at all the other challenges, I think the core of it is that we have users of animal health care who are also not able to afford the services that they need. And that's one thing that I wanted to add to the challenges. And for us, it's also about, government's involvement in this. And I know that up till now, where we have Farm Alert and Cow Tribe, coming into the sector, previously it has mostly been the government's responsibility to provide veterinary health. And we found that across Africa, where, the vets who are employed to go to the very remote places are government vets and not private vets. And that is something, again, that has actually not been easy to deliver, especially when budget, from government is reduced for veterinary services. And now that we are moving into a new era, and partners like, private partners are coming on board to deliver these kind of services, it's also good to recognize that governments, structures and systems and that are in place are also inhibiting, the ability to be able to provide services to farmers in remote places. I can give an example of Ghana, where, up to 20 years ago, government funded veterinary vaccine delivery in remote places. And my dad, who happens to be a sanitary inspector, was brought on board at some point to go and help vaccinate animals in remote places about 30 years ago. I was still a kid, and I remember following him in the dark, to villages to deliver vaccines to farmers. And 30 years down the line, vaccines are no longer delivered by government because, most of these are privatized, and there are no structures in place to make sure that, private actors are able to go to the remotest place. And so I believe strongly that the relationship between government, as I said, and then the private actors need to be stronger to be able to make this happen. Now, let me just bring you a bit into how we see the solution. Like I said, we believe that the solution lies in making vaccines accessible. And I think when COVID happened, it was quite easier to explain why vaccines are important. And we do believe that if farmers vaccinate, if we have access to vaccines for farmers, smallholder farmers, and if all farmers are vaccinating their animals, then the disease burden can reduce. And this has actually been proven in the case of several diseases in human and also that of even livestock, where rendipest we were able to eradicate because we had a very conscious effort in place across Africa to make sure that every animal was vaccinated at some point. So we strongly believe that using technology can also make vaccines accessible, and that is why for 4 years now, Cow Tribe has just been focused on building that kind of technology to do that. And the technology we are building is actually done recognizing that the work we are doing is within white spaces, where people haven't done this before. There hasn't been any technology of this kind trying to get vaccines accessible. And so we've been building it from scratch. And our technology is focused on solving some of the problems that Femi has mentioned. Number one, getting the products to the last mile more cheaply and more with the quality that it came from the manufacturer. And that has been a key issue. And so our logistical challenges can be solved when we have a technology that aggregates demand from farmers, getting that demand visible to manufacturers, and manufacturers responding by being able to send the products that are needed by these farmers in bulk, so that it is more of it saves costs for the farmers. So that is one thing that we've been focused on. The second bit of it is just, understanding that for 30 years of not doing vaccination means that we have a new generation of farmers who really don't understand what vaccine means. And it requires you to spend some effort to educate them about vaccines. And to do that cheaply requires that we use technology. And so in CowTribe, what we've been focusing on is using mobile voice messaging. And this allows us to be able to send messages to, millions of farmers without, walking out of your office. And you still are able to provide these services as cheap as possible. And I would leave it here. And I would say that I'm sure there are follow-up questions based on what I've said so far. And then we can take the conversation to the next level.
Thank you so much, Peter. Honestly, preventive animal health, I love that, and it's very key. And also to make vaccines accessible, to livestock and livestock keepers is very, very important. So to take us to the next level of this discussion, I'm so happy to call on Dr. Moses. Dr. Moses, please, over to you.
All right, thank you, Josephine. Thank you to Femi and to Peter for the update so far. There are barriers to animal health operations in sub-Saharan Africa because as we have listened to Peter and to Femi, we see that there are quite some challenges in Africa. But then what do we do? And then if we are able to identify what the barriers really are, then we can begin to think of how to enhance, animal health. So what are the barriers to animal health operations in SSA? In my experience working in Nigeria, in Ghana, Kenya, Ethiopia, moving around in SSA, there are basically about 6 or 7 of these barriers, just to put it broadly, due to our limited time. The first one is there's no regulation. There is no regulation. Everybody brings whatever he wants. Speaking from my perspective as Boringa Ingelheim Animal Health staff, there are so many things we have that we can bring as solutions to the table. But we have to follow the regulations. We have to do what the country says to do. We have to go through the proper channel. But what we have discovered is that there's no regulation in the SSA market. And this does not allow and permit for quality. Because when Femi was talking, he said access to quality inputs is one of the challenges. And so when you have influx of everything and anything from anywhere, that becomes a very major challenge. So there is no regulation, and this, of course, has to do with legislation. Then secondly is the disease surveillance. There's no vibrant disease surveillance system. We are talking of avian influenza, we are talking FMD. These are diseases that are global in nature, and as of today, we should think that in SSA there should be a kind of surveillance system for this disease. It does not exist. Where it does, it doesn't have the robust presence that it should have. That is the second one. Then the third, we talk of digitalization. This is where the world is going today, and the average farmer in SSA is not yet digital, thanks to Farmer Lab, thanks to CowTribe, trying to do things in a more digital way. If we don't transcend from where we are to being digital, then we'll be left behind. So it's a major challenge to enhancing animal health. There are people in the remote areas. We can't go everywhere. We can't reach everybody. But if there's a kind of digitalization, we would be able to spread the reach much more. So I see this as a barrier also to enhancing animal health. The fourth of it is data. I'm saying this not in any order of priority, but data is a very huge problem in Africa, in SSA, Sub-Saharan Africa. You ask a farmer, okay, how many poultry do you think exist in Nigeria? Then you get 10 different figures. There's no globally accepted figure. You go to Liberia, you ask how many livestock do you have? Somebody say 5 million, and somebody tells you it's 20 million. And somebody else tells you, no, we don't have that. Yes, just 3 million. So there's no data. And when there is no globally adopted data in SSA, it becomes a huge problem. As BI, we have been working, trying to collate this data since 2015, trying to build something that could become like a reference point. So that also abounds as a huge challenge. Then, of course, we want to talk about funding. Funding is a major challenge in sub-Saharan Africa. The farmer wants to expand. He hears about new technology. He hears about the things that are obtained in other climes. He desires to implement them, but he has no money to do that. There are no funds. I'm sure Cow Tribe and Farm-Alert, I mean, we're talking MMH. We're talking the approach of BI through MMH to collaborate, because BI believes in what they are doing, and the idea of collaboration is to support. So the funding is necessary. If we want to change, if we want to enhance animal health in SSA, there must be a kind of funding support to see this change. Then we talk about the market itself in sub-Saharan Africa. The market is so unstable. You know, I'm supposed to go to Ethiopia sometimes next week, but they have declared nationwide emergency because of crisis coming up out of this country. And I'm going there to do what? To impart knowledge, to support hatchery, with which we are in a collaboration. And now most likely this trip is not going to happen. Africa is so, I mean, the market in SSA is so unpredictable because of, I mean, just like this, something could happen. We have insurgencies and all this, and the economy itself is not stable. You look at the Forex challenge in Nigeria today, dollar to Naira is 575 today, tomorrow is 580, next tomorrow. I mean, how do you plan, you know, with fluctuating economic situations? These are the challenges that are forming a barrier to enhancing the animal health. We have the unregulated space, we have digitalization not as it should be, we have the funding, we have absence of disease surveillance, and so on. And I'll close by this. I discovered some months ago that it will take a vehicle moving at 110 kilometers per hour, it will take that car 157 years to arrive the sun. But if someone was to ride on a beam of light, he will get to the sun in 8 minutes and 20 seconds. Light connotes knowledge. We need knowledge in sub-Saharan Africa. We need to gain speed. We have lost time. We are so behind. But if knowledge is abundant, if knowledge is made available, I believe we can make up for the lost time. And so one of the things we have done as BI, we train, we retrain. We've done the same with Cow Tribe. We've also done some, I mean, maybe 4 trainings now with Farm-Alert in collaboration. We believe knowledge should be spread. We need training. We need retraining in sub-Saharan Africa. This is one of the ways we can overcome the barrier. Thank you so much.
Thank you so much, Dr. Moses. Wow, that's an amazing explanation of all the barriers in SSA. And I'm happy that you also showed us the way out, training and retraining. And I'm so glad that MMH, you are doing an amazing work with training entrepreneurs to be able to deal with these barriers. So now we are going to go to Madam Baju as she talks about the veterinary practice in Nigeria and the role of government and private sector collaboration. I'm sure some of these barriers will be dealt with also in her speech. Madam Baju, over to you.
Thank you very much, Josephine. I'm just so delighted and happy because what I've just heard, especially from Dr. Arokoyo, is quite encouraging. Not that I'm happy there are barriers, but that the Veterinary Council of Nigeria is actually focusing on the right direction. Because all the issues, all the barriers listed are the things that the Veterinary Council of Nigeria is focusing on. First, by way of introduction, for those that are not aware, the Veterinary Council of Nigeria is the regulatory agency body for all veterinary and paraprofessionals in Nigeria that regulates the training of veterinarians and paraprofessionals as well as the practice. So we are in charge of entire training. And I'm happy also to mention here that Dr. Femi is also an elected member of council. In fact, I can tell you he's the youngest in the history of Veterinary Council of Nigeria. The youngest member of council, and is making great impact, supporting with his with digitalization that we're focusing on at the moment. So I can tell you that we are really working very hard. First and foremost, since inception, this council was inaugurated in 2019 and 2020, sorry, March. So we're just barely 2 years, getting to 2 years now. And when we came on board, with the first thing, the first challenge that we faced was that immediately after 3 weeks after inauguration, there was a total lockdown. And that was the first challenge that the council faced. And where was it? At that time, we were so happy that the government has invested so much in the animal health industry. By first and foremost, yes, of course, a lot of people were crying why we locked our borders for us to be able to look inward and start production. We're able, farmers, poultry farm was able to thrive very well. There was so much government support. And when the lockdown came, it came along with a lot of impact, whereby farmers were not able to convey animal produce across the federation, and we were at the verge of losing this and running into food crisis. And another thing was that veterinarians and paraprofessionals were not listed in the essential service providers. And council came immediately and made a statement and met with government and government agencies to ensure that veterinarians are listed as essential service providers, and we have permit for free movement of animal products across the federation. And then we were able to move veterinarians to allow them have access, that they are able to provide services to ensure that the animal health industry was saved from total collapse. And that was a very huge success for us in this country. Otherwise, the story will have changed. And so as time goes on, we are focused. The Veterinary Council is very concerned, focused on all these challenges affecting animal health sector. And we're very committed and focused because all our programs are targeted at those barriers that Dr. Arokoyo has just raised. One of them is raising the standard of training, because we're looking at OIE regulations, day one, focusing on day one competencies. Veterinarians is able to have all this. So we are now entirely reviewing the curriculum of the veterinary training in all our universities. And that one is going to ensure that we improve and scale access, to provide enabling environment for animal health to thrive in Nigeria in many, many ways. So, and then part of the thing is that Arokoye talked about digitalization. So I can tell you digitization is a top priority of the Veterinary Council of Nigeria. We are trying to digitize the entire system, the entire process, whereby we are able to provide services to farmers. We'll be able to organize everything, digitize, because one major issue we have is also having quacks that are parading themselves as veterinary professionals. So by digitizing, and one of the issues that we're also collaborating with Google, and we have had about 2 or 3 meetings to raise the skills of veterinarians and paraprofessionals so that we can everybody now is, whether it's a farmer, the Fulani man moving, he has his phone, he knows how to do so many things. Even if he cannot write, he can send voice message through WhatsApp, they know how to do it. So these are some of the things. We raise the standard of our professionals. And then we talked about no regulation in the sector. The council, as it is now, we are focusing on improving on our laws so that we strengthen the veterinary profession to be able to effectively impact on the livestock industry. And while we're doing it, we are now amending our Veterinary Surgeons Act. We are reviewing our Animal Diseases Control Act to be able to answer all the questions, all the challenges, current challenges that we are facing in delivering services for effective animal health delivery. And another thing is that we are talking about enforcement. 2 months ago, we flagged up what we call the National fight against quack and quackery. And we did that with the Veterinary Premises Practice Committee, which is one of the standing committees in council. And we went around the states inaugurating veterinary practice premises committees in order to empower them. And then we will soon, very soon, I'm sure you'll see us, we are going to start shutting down all illegal veterinary services, all these issues of antimicrobial resistance that Femi raised. We want to deal with them to ensure that we provide the services and that we eradicate antimicrobial resistance in our community. And another big thing is we are focusing on organizing the entire veterinary animal health professionals, from veterinarians, from animal scientists, veterinary paraprofessionals, because if we don't organize the entire team together, then this issue of rivalry, somebody will go beyond his level of training and so on and so forth, because those are the issues. Somebody that is not trained to handle certain, you're not a vet, you are not a doctor, you go and do work that is dedicated, that is supposed to be for a veterinarian. And those jobs that are supposed to be for the paraprofessional veterinarians are doing it. So you find out that there's so much tension, there's so much fight in-house, and it's not going to help the system. Because if we don't sanitize and everybody understands, I keep giving them example. When you go to your hospital, from the time you get to the receptionist to the time you leave the hospital, you must have seen about 5 professionals, from the medical record person that will register you, to the nurses that will take your vital parameters, to the doctor. You go to the lab and take sample. There's a laboratory technologist. You go to the radiology section. You see a radiographer. It's not a human, it's not a doctor that you see. So the veterinarians also will understand this. And then we are going to sit down on the table, develop an SOP so that everybody knows its roles. And at the end of the day, we synergize together and provide the best services for animal health industry in Nigeria. So those are some of the things that we're actually focusing on at the moment to ensure that the animal health industry is sanitized. We have the necessary regulations, the digitization, the data that we're talking about is part of the digitization that we're going to, and training and retraining program. We have the continuing education committee as a standing committee in council. And what we have done, we want to shift from business as usual of just having one continuing education program for council, but we want to deregularize it so that you focus on different specialty, and we give accreditation to different associations, different specialist group. When you come to council, we assess the level of your training, and we allocate what we call the point system. So we just say veterinarians should be able to get certain points before the end of the year for you to enhance your skills, because veterinary practice, veterinary paraprofessional, it is all about skills. So we want to ensure that we maintain that level of skill to make sure that our animal health industry thrives in Nigeria. These are some of the issues we are doing. And I can also tell you on the COVID-19 pandemic, the Veterinary Council of Nigeria has developed a protocol on COVID-19 in animals for Nigeria. This is the first of its kind in Africa. ECOWAS want to adopt it as an ECOWAS protocol. Now we are working with FAO to ensure that they have already they have written to us that they are going to help us in the implementation of this document. And we are working very closely also in the training of paraprofessionals. There are so many things this council is doing, I can tell you, to ensure that all these challenges and barriers that we have identified, that are being identified by my brother from Peter from Ghana, by Orokoyo, my brother, and Dr. Femi, the council is very, very concerned. And that was why before we even took this decision, council believed that everybody, all the stakeholders, have a right to tell us what is it that you want to see in your council. And we did a Google survey online to say, veterinarians, what do you see your council do? And it's a collation of all these concerns that is now forming a roadmap for the Veterinary Council of Nigeria. And that is where we are focusing, because we want to take veterinarians where they want to be. We want to make sure that we protect our resources, our animal health resources. So basically, that is what we're doing in council.
Yeah, Thank you, Dr. Baju. This is amazing. Thank you so much for sharing the roadmap. I love the fact that veterinary workers were listed during the lockdown because it would have been a very, very bad situation. Yes, thank you so much. Yes, thank you. All right, so we are going to now move back to Peter Awe to tell us more on the animal health ecosystem in Ghana. Peter, over to you. And please, before Peter starts, let's use the chat box to put up all our questions, any questions you have, because there will be a Q&A session. So please use the chat box. I only see one question. Please, we need more. Thank you. Over to you, Peter.
Thank you, Josephine. And thank you, Dr. Aisha, too, for the elaborate, presentation on what is happening in Nigeria. I'm hoping at some point we will get to discuss further on how digitization can help your country to move faster. And coming back to Ghana, I think I want to mention that the ecosystem in Ghana is quite similar to what you would find across Africa. And the players are also quite, positioned at different levels and playing different roles. In Ghana, the law that establishes the veterinary practice has the council, just as we have in Nigeria, and the council is responsible for regulating the training of veterinary professionals in the system. We have a university, I think 2 universities that train veterinary doctors. We also have some doctors who are trained outside the country, but when they come back, they must be certified to be able to practice in Ghana. The second bit of the second bit of actors that we have are what we call the paraprofessionals, and I think it's if you go in rural areas across Ghana, you have paraprofessionals practicing, working along smallholder farmers to improve their skills and also provide services. We have other, importers of and distributors of veterinary products in the system. Some of them are registered, others are not. And I think Dr. Aisha too mentioned the quacks that we're talking about. And that has been a very big issue since we started it 4 years ago. We've witnessed so much work of quacks that it's a bit of a border that the works that are done by the professionals are always, not meeting the required, results that we are looking for, because then you are injecting, you are giving vaccines to a healthy animal, and the next time they are receiving service from a quack, it just it would undo everything that you did. So that is quite expensive, and I think that is one area that we have to start looking at. And when Doctor mentioned that, Nigeria is trying to figure out how to get out, make sure doctors are recognized and farmers can also recognize who is a quack and who is not. It's really going to be a big impact on the quality of services that are provided by noting that these farmers who are accessing the services are not mostly educated, so they don't know even how to read the products that they are buying. So it's really important when it comes to the regulatory side that we find a way to make sure that they are rather dealing with professionals and not the quacks that are in the market. I must say that we have private actors who are quite willing to push to the last mile, but not all of them are able to do that. So currently I can say we can count about 20 importers of various veterinary products in Ghana, but just a few of them can go to the last mile, and most of them are in the cities where they would just wait for farmers to come and buy. And I think that is also one area that we can say the ecosystem is. Permit me to say that all these actors seems to be working in silos. And so you see the difficulty is being able to bring all these actors to work together to be able to push the agenda. And that is actually, I think the last actor is the farmers. We have commercial farmers, we also have smallholder farmers. And the question that has been bothering me and my team on the ground is, how do we ensure that we have an ecosystem that is reinforcing each other's work, and there's no, well, you can't do away with competition, but it is sad when working with government feels like a competition, and some of the vets in the system feel an actor like CowTribe is taking away their job, or it's more like it's a space that we need to be. And so this is where we really need to broaden the conversation to see what is the role of private actors and how do we bring them on board, this conversation about veterinary services. And I think if we're able to do that across Africa, I believe private actors can bring a lot of results. And that is what CowTribe has been doing, because I think we are the first company to try to build technologies to allow vaccines to be distributed at the national level, where you just click on a button and all vets across the country can receive notification of which farmer should be receiving what vaccines at what time. So we've built this over 4 years, but how do you get this accessible to governments across Africa? It's not as if we are a social enterprise. And so after this, we are looking at why won't government be interested in this? And I guess it's because we haven't actually been able to sit at one table where we see what is the win-win for all the actors in the ecosystem, that we can all play in this to make sure that the farmers are getting the services that they need. Let me quickly announce, not bad news, but I'm hoping I will get power before my computer goes off. I have not had power for 12 hours. I have exhausted my battery and everything, and I'm just on life support right now. So I apologize if I jump off, and my Nigerian friends will forgive me because this doesn't happen in Ghana very often.
Thank you, Peter. We hope that your power will stay till the end. So we'll make it fast. Thank you so much. Honestly, the question you are asking is one that we also dabbled with. I think we even talked about that question during Femi's presentation last week, where we are looking at how can we build an ecosystem that is supportive, regardless of competition, is very, very key. So I'm going to leave that question there. I'm sure we'll be able to get to a solution where we will remove silos. And let's go back to Dr. Femi to hear about the ecosystem in Nigeria. Dr. Femi.
All right, thank you, Madam Josephine, and then thank you, Peter. We hope your power stays on till the end. But I want to just also say thank you to the president of the Veterinary Council. Excuse me. There are 4 actors. Let me pick from the energy of Peter. There are 4 actors that Farmalad looks at in Nigeria to act. So we have the farmers, we have the professionals, the animal health professionals, both the veterinary and the paraprofessionals, everybody that plays as a consultant in that ecosystem. We have the drug manufacturers, the vaccines manufacturers. They're a big part of the ecosystem. And we also have the government. Dr. Moses, we understand what I'm talking about because if you want to scale a solution without government involvement in Nigeria, it's almost practically very impossible. You could achieve small success in your community, maybe in your local government, the way we mentioned in Nigeria, but it's difficult to achieve something of national importance without the government involvement. And Farmalad has been very lucky to have somebody in government make input into what we're doing and see how access to some of these solutions that we've been talking about can be easily accessed. And that's the work the president of the council has done for the veterinary community. You can imagine during the COVID, just to reiterate what she said, in Nigeria, everywhere was shut down. And they were stopping professionals from going to farms. You know, one of the most vocal voice we heard then was Dr. Aishatu Abubakar Baji. Funny enough, she had been able to combine her role as the president of the council and also her position as an assistant inspector general of police to allow access. The whole country will have shut down. The food crisis I mentioned when we started this meeting will have been worse off if we don't have the likes of somebody in government and with also the power to ensure that there are easy movement or easy access of some of these essentials. We call them essentials because we're classified as one of the essential services during the COVID-19 period. You know, those assets will have been blocked. And that was one of the big achievements we made as a community in Nigeria. But before I state exactly what Farmalat is doing, I want to quickly just tell the entire community and everybody listening, this is a global convention. And the title of this panel session is Africa, with emphasis on Africa and the global animal health. It's us that will solve our problem, right? We will need partnership from foreign organizations, but local problems are best solved by local people. And that's why we're bringing in people like CalTribe, right? Who understands the insight. What works in Nigeria might not necessarily work in Germany, might not necessarily work. The way we think, it's actually also different. So it can be done. It requires a bold move because the challenges are numerous. The challenges are huge. It also requires a local insight into what's happening and how it can be done. But more importantly, it requires partnership. No one is an island, right? Currently, we just started a discussion with CalTribe. And for us in Farmalat, one of our biggest strengths is that we are a team of animal health experts, right? 15 years in the animal health industry as a person. We have doctors working, we have paraprofessionals also working. So we understand what the farmer needs. But again, if what we understand is all there is, then there will be a lot of issues. So we bring in the likes of, CalTribe mentioned that they've been for 4 years now building like a technology that supplies vaccines to the grassroots. That technology in Farmalat, we don't have it yet, right? So we cannot work in isolation. We cannot work as individuals. Farmalat must find value in what CalTribe is doing. CalTribe must find value in what Farmalat is doing. And we must come together. BI, it's a big partner to both Farmalat and CalTribe, right? BI brings in their expertise. The training we had, BI came in very handy to be part of the training and to also offer their own facility in Ibadan to train farmers. I'm coming to that shortly. So it's not something that can be done as a single person. It has to be a very strong collaboration. Collaboration, Making More Health, Ashoka, BI, CalTribe, Farmalat, the government, the veterinary council, paraprofessionals, professionals all working together to solve a common challenge. So what is Farmalat doing in Nigeria? First of all, we realize that one of the biggest issues we have is that farmers, they think they know, but they really don't know. Because what you know can only show out in results. So if your farm is closing down, regardless of whether you've been in the industry for 20, 30 years, right? The proof of what you know will show up in the results you have. So we notice that there are challenges in Nigeria. And one of the key things we need to focus on is the training and retraining of farmers to find cutting edge technology, to prioritize biosecurity, which is a major thing. And we are happy to announce that we've just recently, last week, launched a Farmalat Academy. We're taking in 10 farmers now that we're going to be taking through the course of 10 weeks on improved poultry production, how to manage, how to grow their poultry business. We're hoping with the partnership of Making More Health and BI, we're able to grow the number very soon after this pilot process to maybe 100 or 1,000 and scale it. We also, the last thing I want to mention is also the project we launched around the real-time advisory services. So sometimes farmers fall into quacks in Nigeria, into the hands of quacks, because they really don't have a formal line or a formal communication line between, there's really no formal communication line between the farmers and the professionals in Nigeria. And one of the things the council, the veterinary council, under the leadership of the president of the council, who is here, is doing is to see how we can formalize that line between the farmers and the professionals. And what Farmalat has done in the interim is to have a unique number share that farmers anywhere can call. It's an advisory service. We call it the RAS project, real-time advisory service. You have a challenge anywhere, you need to talk to a professional without falling into wrong hands. We've just officially opened this line. And I think with the academy and our official line and creating service centers in clusters of farms, we go a long way in solving our real-time issue in Africa. Thank you very much.
Thank you, Dr. Femi. That's amazing. And really, it brings back the importance of collaboration. We need all actors in this. We need to break down the silos. We need to all come together for the common purpose to solve the challenges that are in Africa in animal health and any other field. It's very, very key. So now is that session for question and answers. I know we only have one question on the chat. So please, this is your opportunity. If you have questions for either Dr. Femi. Okay, I see someone is raising their hand. All right, we will come to the hand. So Dr. Femi, can you take the first question that Dominic asked, and then we'll come to Cheryl. Please take Dominic's question. He's asking,
okay,
yeah, just go ahead. Go ahead.
He said, I will be keen to hear about how low cost and no cost digital tech can make, well, it can make a huge difference. One of the reasons why farms are closing down in Nigeria is because of the high cost. Input has doubled or tripled in Nigeria, cost of feed. We were buying, maybe we're buying a bag of feed for around $9 to $10. Now, those cost of feeds are around $30 per bag. It's difficult if we don't have innovative ways of ensuring that we beat down this cost for farmers. The dollar crisis too in Nigeria, I don't know what it is in Ghana. Maybe Peter will share like a view of what's happening. But the dollar price has increased the cost of our vaccines because most of them, 60 to 70% of the vaccines we use in Nigeria, sadly, are imported. So if we don't design ways, low cost ways or digital ways of ensuring that the farmer gets the needed product right on time and at the lowest cost possible, then the food crisis I mentioned when I was starting my statement will be imminent. So it does make a very huge difference, and we are open to technology that can help us scale down the cost of these products to farmers.
So can I come in quickly?
Yeah, yes, Peter, just 1 minute. Yeah.
Yes. So I think the question is about whether low cost or no cost digital technology can make a difference, and it's yes. So number one, using SMS to do education versus going to the farmer's doorstep is going to cut down the cost of educating farmers by almost like 10 times. So that is one thing that we've noted. We can share more information later after this because we've tried it over thousands of farmers and we've seen that it's the same knowledge they are receiving, but at a lower cost to the knowledge provider. So this is really possible. The second one is that using technology to aggregate, fragmented demand across, larger geographies. For instance, that is what CowTribe is seeking to do, where you have smallholder farmers scattered everywhere. If you're able to gather their demand before you go to procure the products, then you are also able to cut down costs more than 10 times. Then the cost of delivery itself is also, we've been able to reduce the cost of delivery by 5 times. In Ghana here, vaccine delivery by 5 times. So Dr. Aisha too, if you are providing vaccines to the farmer, it's more likely that the vaccine will cost $1, but then you are spending $5 to deliver to the farmer. That shouldn't be the case. And that's the reason why the government will not give you a budget to go and deliver vaccines. I think if you go to the government, the president, and say, I can deliver a vaccine at 50 cents and the farmer is paying $1, it's more sensible that way. And that is how we can actually be able to make the difference that we are looking for in the industry. This is just something I wanted to share on the technology bit of things. Yeah.
Thank you, Peter. Share your question. Your hand is up.
Okay. Yeah. So good day, everyone. My name is Shehu, just as displayed. I work for AmboVet Consult Nigeria Limited, and we are very keen on last mile access to animal health services in Nigeria also. And I would like to commend the effort of Farmerlat and Caltrap on what they're doing at Nigeria and Ghana, and respectively. So talking about government, I think I would like to support what Femi said earlier. That it's difficult for you to scale this kind of innovations without full government involvement. But what I actually see happening in the landscape is lack of coordinated, documented, will I say, efforts or engagement with government. So we collaborate with government mostly at the verbal level. We do not have framework. So what I'm encouraging in a nutshell is, can we pursue to domesticate this framework such as the OIE, public-private partnership framework? Unless you have a document and a framework that guides how government is going to work with private sector to deliver animal health services, documented with commitment, with MOU signed with government, then we will all just be rounding, going around the cycle all the time. So in Kaduna State, for example, we have successfully done that on PPR and Newcastle disease control with Kaduna State government. We need to pursue a national level framework for public-private partnership. And thank God, Madam President is here, and I'm glad. I know that she's very keen about issues like this. If we can promote public-private partner at national level, then we can have not only Farmerlat, not only culture, we can have a lot of vet practices or animal health service providers, coming on board, and then we'll be able, it's going to be win-win for all. And that will probably take the seemingly resistance that culture mentioned about some governments, officials thinking as if you have come to take their job away. So there's going to be clear definition of who does what and how, So then secondly, it's the role of, para-professionals, community animal health workers. We cannot, continue to pretend that when we talk about professionals, we cannot pretend that only veterinarians are professionals. It is not true. These para-professionals mostly have gone through a certified training. What we need is to promote their recognition and then distinguish between what they can do and what vets do.
Thank you, Shehu. Thank you. Yeah. Thank you for your comments. Thank you so much. It really resonates with what we have been saying. And also in the chat box, we have a comment from Senen, and I'll read it. He said, farmers tend to reduce the quality of their feed as a result of rising cost of feed and raw materials. This then leads to a low productivity and the farmer tends to lose money. A good example is when farmers dilute their poultry feed with more fibers like wheat or maize offals. As educators, may I advise that we should inform the farmers on how to make more profits amidst rising cost of feeds. We must remember that feed cost is going high, but nutrient requirements of the animals are not changing. So I don't know whether Dr. Femi or Peter, you have a comment on this. How do you balance that, the rising feed costs and maintaining the nutrient requirements of the animal, which doesn't change?
Okay, so I think it's just a comment. What I will probably want us to do is based on what Dr. Shehu has said, if the president of the council has a comment around, because the government partnership is really very important in Nigeria and then across Africa. The president.
All right. Yeah, thank you, Dr. Baju. Can you have 1 minute?
Oh, thank you very much. The council as it is, honestly, is very committed to partner with any private with the private sector to ensure we improve on the services. And just like Dr. Shamsuddin said, he can come forward. We have an open door policy in council. They can come forward and then we have a discussion for us to be able to come up with a national framework for private partnership in the livestock industry. And we also need collaboration between all the regulatory agencies within the African sub-regions for us to be able to see a very positive change. Before I go, I know it's just 1 minute. I want to recognize, I can see I have two very prominent members of the Veterinary Council of Nigeria. Dr. Gani Enahoro, who is the chairman of the Continuing Education Program, which is one of the very important standing committees in council and is doing very well. And we also have Dr. Tunji Naso, the chairman of the Private Premises Committee, who is working very tirelessly to ensure that we deal with the issues of quackery in Nigeria to be able to bring a very healthy livestock industry in the country. I thank you so much for having us here, and I look forward to very fruitful collaboration in the future. Thank you.
Thank you. Thank you so much, Doctor. Doctor has actually did the summary of our meet. So it's really wonderful to have all of you here. So as we go now, it's important that we realize that all of us, all hands on deck, we must work towards to solve the solution, to solve the problems and make sure that we localize Africa's solutions. Apart from that, it's key to collaborate. The importance of partnership, that was the thread across all discussion here. It's very important for us to come together. Let's remove the silos. Let's come together and solve the problems that are in Africa for Africa so that we can build a laudable animal health community. Thank you everyone for attending. Thank you, BI. Thank you, Ashoka. And thank you to our speakers, Dr. Moses, Peter, Kayode, and Madam Baju. Thank you so much. Thank you, everyone.
Thank you very much, Josephine.
Thank you, everyone.
Thank you, everyone.
Bye.
Thank you for participating.
Have a good afternoon.
Good afternoon.
Yes, you. All of
Thank you very much, sir.
Yeah.
Bye.
Thank you very much.
Bye.
Bye-bye.
Oh, okay. Well, thank you.
So thank you, Madam Josephine, for the wonderful coordination. That was fantastic. Thank you so much.
Thank you.
And we're on time. And thank you, Madam President, for calling.
Thank you, thank you.
Thank you.
Thank you, Madam.
Yeah, thank you, Madam Baju. That was interesting. Honestly, I loved your contributions. Thank you. I never knew you guys were doing all that.
Oh, yeah.
Now I know.
Thank you.
Oh, I
and
know.
Dr. Moses, thank you so very much.
Dr.
Moses is our man, so he can't run away. We captured him many years ago. Thank you.
All right, have a good day. Bye.
You too. All right. Bye-bye.
Bye-bye.
Yeah.
Bye.